I recently asked my Instagram followers to send me their questions that they had on Botox, and there were a lot of them. So I'm going to do my best to answer as many as I can for you today. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist. I'm here to help you understand your skin and find skincare products that work for you. If you like what you see, like this video and subscribe to the channel. Maybe you clicked on this video because you have never gotten an injectable treatment like Botox before and you're interested in having more information, or maybe you've been getting Botox for a long time and want to see if any of the questions that might still be floating out there in your mind can be answered here. But either way, I appreciate you being here. I also want to say that this video is not meant to persuade anyone to get a Botox treatment. This is purely informational. So I'm not trying to make anyone get anything that they're not comfortable with. I just think the more information, the better, and then everyone can make a decision that feels right to them. Before I start answering your questions, I wanted to do a very brief overview of what Botox is. For some of you, this is going to be a review, and maybe for some of you, this will be the first time you're hearing a real explanation of what Botox means. But essentially, Botox is a type of botulinum toxin that is purified in a way where it can be injected into muscles in order to induce relaxation of those muscles. So it's used to treat wrinkles, usually of the face, that are due to repetitive muscle movements. So you can think about if you scowl over and over and over again, you can inject those muscles with Botox to prevent that. What Botox is not is something that leads to volumization of the face. So I have patients who come in and say, "Ooh, I don't want Botox in my lips, they're gonna look crazy." That's not what Botox does. It doesn't add volume. That's what filler does. Filler is a different type of injectable. I can totally do another video on filler, but Botox is really meant to relax muscles. It does not do anything to volumize or contour the face. The other thing is that Botox is just one brand of neurotoxin, but it was the first one on the market. So it's how we sort of refer to the procedure in general. It's like saying Kleenex to refer to tissue. We know there are other types of tissues out there, but because Kleenex has just sort of established itself in the booger wiping space, we call them Kleenex. It's the same thing with Botox. So there's other brands like Dysport and Xeomin, and we'll definitely talk a bit about those today. But it's just to let you know that there are other things that can do the same thing as Botox, but we sort of generically call it Botox because that's the name that people are most familiar with in the general community. Okay, enough of me blabbing on. Let's get into your questions. All right. Differences between Botox, Dysport, Xeomin, etc. Trying to decide how into the nitty-gritty scientifically I should get for this versus how they're sort of different just in terms of how they would act in the body. So I guess I should start out by saying there are 7 different types of botulinum toxin type A, B, C, D, E, F, and G. And all of the ones that we use cosmetically, so like Botox, Dysport, Xeomin, those are all botulinum toxin type A. So they're all in the same category of neurotoxin. Because they are all the same subtype of botulinum toxin type A, they all have the same mechanism of action in the tissue in terms of how they disrupt the communication between nerves and muscles. And that's kind of the most important thing, is they all work in the tissues very similarly, which is why when they're injected, you can achieve very similar outcomes with any one of them. I know I'm talking more about the similarities here, but that's because the differences really lie on sort of the molecular level as well as the manufacturing process, rather than how these molecules actually behave once they are injected into tissue. All 3 are approved by the FDA for cosmetic injections. Botox has been around the longest. So it was initially discovered in, I think like the 1970s, was first FDA approved in 1989, and then was approved for cosmetic use in 2002. So it sort of has this long track record of trial and safety, which is why I think a lot of injectors and a lot of patients feel the most comfortable with Botox. That being said, Dysport and Xeomin are also very safe and effective. Dysport was approved by the FDA for cosmetic use in 2009, and Xeomin, came shortly behind in 2011 with its FDA approval for cosmetic use. So these are all very vetted neurotoxins and all have a very good track record of safety and efficacy. Now, of course, all 3 of these various toxins have to be slightly different in order for them to be manufactured and marketed by 3 different pharmaceutical companies. So when you get to the molecular level, these are slightly different proteins. Botox has its own central neurotoxin protein and its own set of what we call accessory proteins or complexing proteins. So something beyond just the central neurotoxin. The same with Dysport, it has its own set of accessory proteins. And then Xeomin's slightly different because its sort of claim to fame is that it doesn't have any of these accessory proteins. It's sort of a pure neurotoxin. So molecularly, they're different, they're manufactured different, they're stored differently, but when it comes down to it, they can all do the same thing. Next, how does Botox compare to Dysport? All right, basically everything I just said. In terms of how patients perceive it, there are some patients who will find that Dysport lasts longer for them, whereas other patients will find that Botox lasts longer for them. Some people feel that Dysport gives them more of an initial freeze, while other people will feel that Botox is the toxin that does that for them. So I explain it to patients, it's like Coke versus Pepsi. Most people with a blind taste test cannot tell the difference. However, there are going to be those individuals that have a strong preference for one versus the other based on how their body interacts with one neurotoxin versus the other. One thing I will generally say though is that Dysport tends to kick in a couple days before Botox. So for most people, they will notice Botox kicking in somewhere between like 3 and 10 days after their injections. Whereas with Dysport, they might notice it kicking in maybe like a day or two after injections. And so I think that's the biggest thing that injectors notice as well, is that Dysport tends to kick in faster. Some people say that Dysport tends to spread or diffuse more, but again, that's not something that has really bore out in rigorous clinical trials. It's just something that injectors will say anecdotally. How do you decide if Botox or Dysport is best for your patient? Generally, I'm not the one deciding that. I think they are so clinically similar that oftentimes the patient themselves will decide whether they prefer Botox or Dysport. If they've never had anything injected before, I think a lot of patients prefer to go with Botox because it's sort of the household name and it's been around the longest. But again, I do have patients who just have that preference for Dysport, and that's what I will inject in that case. I'm not usually the one making that decision for them. Also, in some clinics, Dysport will be slightly cheaper than Botox. And I think the financial sort of impact of the injections can also make a difference whether a patient prefers one versus the other, especially if they don't notice a big difference with how it acts in their body. As a follow-up to that, some of you may be wondering, well, like, why is Dysport cheaper at some clinics? Is it inferior, or what's the deal with that? And really no, it's just that Botox and Dysport are manufactured by 2 different pharmaceutical companies. Those 2 pharmaceutical companies charge the clinic different amounts of money to buy the initial toxin. And generally, historically, Botox has been more expensive for clinics to purchase, and so sometimes that cost gets passed along to the patient. What are the most popular Botox requests? Okay, and I'm speaking from a cosmetic dermatologist point of view, right? Like, I don't know what the most common request is in a pain clinic or in a movement disorder clinic, which are other non-cosmetic clinics that also utilize Botox for functional improvements or pain management. So in a dermatologic cosmetic setting, I would say the most common requests I get for Botox are for the treatment of 11 lines. So the creases that can form between the eyebrows with repeated scowling or frowning, as well as the treatment of horizontal forehead lines. So if you raise your brows up really high and you see those horizontal lines, Botox can really help with that. And then I think probably the third most common request is crow's feet. So if you smile really big and you get those little crow's feet, Botox can help soften those. I don't feel like it ever should be used to completely eliminate them, because I feel like those lines and that movement is what gives you personality and what makes you warm and friendly and gives you your ability to express emotion, which I think most people want. But those are the 3 areas where patients come in and seem most distressed about and want to use Botox to fix it. The other thing I'm getting tons of requests for in terms of Botox treatment is for the treatment of tension in the jaw, as well as masseter hypertrophy, so overgrowth or bulkiness of the masseter or the chewing muscle at the back of the jaw. So lots of people are clenchers or grinders, and you get this tension that builds up in this muscle, and Botox is used to relax that muscle. It will slim the face as a side effect because you're deactivating that muscle to some degree. It's not going to be working out as intensely. It's going to get slimmer. It's going to make the face slimmer. But I think just lower facial Botox in general has been on the rise, whether we're treating masseters for that reason, or whether we're treating the jawline or the platysmal bands, so the neck bands that can become more prominent with age. And it's kind of nice to see, because I think previously people were so focused on their upper face, and then the bottom half of their face was just going into like an aging wasteland. And now I think people are more open and understanding of the idea that neurotoxin can be used throughout the face and neck to really achieve more facial balance and harmony. Will Botox help deep set in forehead wrinkles, or is it mostly for fine lines? The deeper the line is, the more time it will take from the initial time you get Botox for that line to soften up. So for example, if someone comes in and they are just starting to notice horizontal forehead lines at rest and we inject them with Botox, it's possible that at their follow-up appointment in 3 months, when they're coming back in for their next round of Botox because their Botox is worn off, their forehead will look completely smooth because that line was small and shallow enough that decreasing forehead movement for just 3 months allowed that skin enough time to rebound and heal. Now, there are people who have deeper lines that need to do Botox consistently for months or even years for their skin to have adequate time to rebound and heal. And then there are going to be people whose lines are so etched in that even if you froze their forehead with Botox, for the rest of their days, those lines would never fully go away. And that's not just a function of the depth of the wrinkle, but also the quality of their skin. So you could have two people that have the same depth of forehead lines, and one will correct fully with Botox and one won't. And some of that has to do with how damaged their tissues are or how healthy their skin is, I guess, to put a more positive spin on it. That being said, it doesn't mean that Botox is completely unnecessary or unhelpful. Usually, someone can get some degree of softening of a line, even if they won't be able to fully eliminate it or fully make it go away. And it's often why in my patients who come to me with more etched in lines, we don't just talk about using Botox as their main method of rejuvenation. We talk about laser resurfacing or chemical peels or filler to volumize some of those wrinkles and pop them out a little bit. I think a huge mistake is relying on Botox exclusively to rejuvenate someone who maybe has a little bit more tissue damage or has lines that are more etched in. Would you use Botox for nasolabial folds? I'm so glad someone asked this and I have the opportunity to answer it. So nasolabial folds or melolabial folds are the creases or folds or shadows that start to form right here. And some people are born with them. Some people naturally have more obvious nasolabial folds than others. And it is one of the biggest cosmetic complaints I get in my office when someone's coming in for a cosmetic consultation. And so many times people will be like, can you just put Botox in there? But remember, Botox is used to relax muscles. So this line is a function of a few things. It's a function of the fat in our face sort of descending, as well as skin laxity, also causing descent and shadowing. It's a function of us smiling and causing creasing there. But just think, if you had to use Botox to relax the muscles of the face to eliminate that line, where would you have to put Botox? You'd have to put it like in your cheeks and around your mouth. And so yes, you would not be forming that line anymore, but you would also be unable to smile, unable to talk, unable to activate any part of your mid-face. So Botox is absolutely not the way we address nasolabial folds. Can it fix hooded/tired looking eyes? It really depends how hooded and how tired. So with Botox in the right candidate, injected into the right place, you can get some lifting of the brow as well as softening of wrinkles around the eyes, which absolutely can make a hooded, tired looking eye less hooded and less tired. That being said, if you have a lot of hooding or a lot of redundant tissue on the upper eyelid, Botox can only offer someone so much. With that being said, it's not uncommon for me to refer my patients to a cosmetic surgeon to have their eyelids dealt with in a surgical procedure. And I understand that many people come to a dermatologist because they don't want something as invasive as surgery, but I feel like it's my duty as their physician to guide them and let them know what's achievable with less invasive options and what's achievable with more invasive options, and then let the patient decide what's the best option for them after they've been educated on both. What to look for when shopping for a Botox injector. Oof, this is really hard. I feel the patient's pain when trying to find an injector, and it's because There are so many different types of medical professionals that are legally allowed to inject Botox. So that's one thing. So it's like, what is their training background? What is their expertise? How did they learn this procedure? How are they keeping up on their qualifications? How good are they at what they do? Regardless if they are legally allowed to do it. And then also knowing that some people in this country inject Botox illegally. So one thing you can do is look at training. Is the injector a board certified physician? And if they are a board certified physician, are they board certified in a specialty where injection of neurotoxins, injections of fillers, etc., are part of their accredited training? So things like dermatology, plastic surgery, general surgery with a fellowship in facial plastics, ENT, so ear, nose, and throat doctors, and then some ophthalmology programs will also have Botox injections as part of their training. So are they what we call a core cosmetic specialty, and are they a board certified physician? That can at least let you know that they had very rigorous training to execute this cosmetic procedure. So medical training background can give you some information, but it might not give you the entire picture. So what else can you do to find an injector that's going to be safe and have the expertise that you're looking for? Word of mouth is huge. So do you know someone who's been treated and had a really good experience or a really bad experience? That can tell you about who to avoid. Social media can be helpful to some degree. A lot of doctors, nurses, physician assistants will use that to advertise themselves, to educate patients, to show before and afters, to show reviews of their work. I just always caution people, even as someone who's on social media myself and does some of those things, to take that all with a grain of salt, because while some people are super honest and ethical and show before and afters that are unedited and unretouched, there are certainly people who show retouched before and afters. And that's the hardest thing, because what you see might not be what you get. Which brings me to my final point about this, that the internet or resources that are available to you might not always help you decide who's going to be the best injector for you. And sometimes the best thing you can do is do a consultation. Go to the office, get the vibe, meet the staff, meet the doctor or nurse or physician assistant or whoever's going to be injecting you. See what they have to say. How are they assessing you? Do they answer all of your questions? Do you feel pressured to do something? Does the staff look crazy? Because a lot of us treat our staff, and if you're looking at the staff going like, then maybe you don't want that person injecting you. So the best thing you can do is meet with a potential injector in person and understand what your connection is. Do they understand you? What is their protocol if something were to go wrong or if you were to be unhappy? All of those things will be very helpful in choosing an injector. And also understand that not everyone gets it right on their first try. And if you go to someone and you don't think you're a good match, you can always go to somebody else. But that's why I also always encourage you to go to someone who's going to be safe, because a lot of cosmetic work can be undone, but you need to have that person have safety as their absolute number one priority for you. When do you suggest starting preventative Botox? Age, signs, etc. I think where people can benefit the most from preventative Botox is when your face is at rest. So not when you're scowling, not when you're raising your eyebrows. Do you see wrinkles and fine lines? And if you are seeing them, then starting Botox at that point, when you're first starting to notice them, is going to give you the highest likelihood of full correction, meaning full smoothing of those areas if you start Botox then and are consistent with it moving forward. What are some off-label benefits of Botox? Does it help with sweating, oil, or pore size? In a medical sense, when we talk about a therapy being off-label, it means that we are using it without FDA approval for that indication. So for example, you might not know that Botox is only approved for wrinkle treatment in the upper face. So when we use Botox aesthetically in the chin, in the jawline, in the neck, that's all off-label. But I think what this question is getting at is like, what are other things that Botox can do for you cosmetically? And yes, in studies, it has been shown to reduce oil production when injected very superficially, as well as reduce pore size when injected very superficially. So those are two super cool benefits. It's not something I do regularly for my patients in my practice, but I am considering incorporating it more now that we have more data to show that this type of use of Botox can be very effective. I clench my jaw when I sleep and have a very swole jaw muscle, LOL. Will Botox help? So yes, I definitely think that if you are clenching a lot and that has led to bulkiness of your masseter muscle, your jaw muscle back here, injecting Botox certainly has been shown to slim the muscle down and make it less swole. That being said, if someone comes to me and they have a history of clenching or grinding, TMJ issues, clicking, lockjaw, any of those things, I also think it's so important that they're plugged in with a dentist so they're having the appropriate care for their teeth and for the bony structures in their mouth. How is it used for sweaty pits? So we call this hyperhidrosis, and you can have hyperhidrosis of the armpits, of palms, of the soles of the feet, or just generally throughout the body. And the way Botox works for hyperhidrosis is it essentially disrupts the signal between the nerve endings and the sweat glands. So the nerves that would normally trigger you to sweat are unable to signal the sweat glands to respond in that way. And for most of my patients who have hyperhidrosis and for whom we inject their armpits, it's done about every 6 months. Botox is actually FDA approved for the treatment of hyperhidrosis, and I believe it got that certification in 2004. How long does it last? For most people, it'll last about 3 to 4 months. That being said, there are people for whom the toxin is gonna wear off sooner than that, and there will be people who get more longevity out of each treatment. And a lot of that has to do with your own biochemistry. But you can expect to need it every 3 to 4 months or so. And when I say wear off, I mean completely wear off. So some patients will come to me and then they'll come back at 2 months and they'll go, oh my gosh, I'm starting to be able to move my brows or my forehead or whatever. And that's normal that after a month or so, it's going to start to wear off. But at what point is it completely worn off? Usually 3 to 4 months. Sorry, the sun is setting. What can I do to make Botox last longer? So there are some small studies that show that supplementation with zinc may help potentiate or prolong the effects of Botox. Now, these are pretty small studies, so it's not really common practice for dermatologists or other injectors to recommend this, but it's something I think that deserves additional exploration. Other than that, how long Botox lasts in you, one has to do with your own biochemistry. It can have a little bit to do with the technique, how the Botox was reconstituted, and also what dose of Botox was used. So we generally know that higher doses of tox will give you a higher or longer duration of effect. How often do you need to do it? So I think of getting Botox sort of like getting your hair highlighted or something like that. There are gonna be people who let it go for a lot longer between treatments than maybe they should, but that's their own choice. They don't care if it starts to grow out. They don't care if their Botox fully wears off. But I think for most people, if they wanna stay on a schedule where they are going to sort of be able to maintain the cosmetic effects, every 3 to 4 months is a good way to go. What are the dangers of doing Botox? Dangers is hard because I don't feel like it's really like a medical word, but I think of dangers as like long-term health consequences. And it's actually incredible. We have so much data for neurotoxin injections for cosmetic use because it's just so well studied. And there actually haven't been any reports of long-term adverse events or negative events from injecting Botox in a cosmetic context. That being said, it is a medical procedure. There can be side effects that are more short-term. I think the scariest one is anaphylaxis or a severe allergic reaction where you lose your ability to breathe. Now, this is incredibly rare, but I think it's why it's so important to really treat Botox like the medical procedure that it is and not have it done at some Tupperware party with your girlfriends, okay? It needs to be done in a clinical setting where if there were to be a scary side effect like that, it could be dealt with appropriately. Side effects that are more common are things like headaches, initial injection site discomfort, and then also bruising because you're putting a needle through the skin, and anytime you do that, you can bruise someone. We use really small, delicate needles when we do Botox, but especially in certain areas that are highly vascular, so areas that have a lot of blood vessels like around the eyes, bruising can be a little bit more common. And then finally, there's the side effect that I think everyone is freaked out about due to a few TikTok videos that circulated in the last year, which is having a lid drop where the person is unable to raise one of their eyes. And that's from the Botox diffusing to a muscle that it was not intended to encounter. And that is really rare. I think most injectors in their career will have a couple of patients who've dealt with that. Knock on wood, I haven't yet, but I'm not so egotistical to think that that side effect couldn't happen to one of my patients, but I take every precaution to hope and make sure that it doesn't. So that's the other thing, is Botox can just diffuse to muscle groups that it's not supposed to and cause asymmetries. These are all temporary, which is great. So the best and worst thing about Botox is that it wears off. So if you really like the effects, you have to continue to get it in order to maintain those effects. But if you were to have a side effect where you have some type of facial asymmetry, sometimes that can be corrected with additional injections or other types of medication, and sometimes you have to wait until the Botox wears off. Botox and pregnancy. Why is it not safe? It's a really good question, because I think women, when they're in that part of their life where they are trying to conceive or actively pregnant or breastfeeding, they have to go sometimes years without getting Botox. And a lot of my patients are like, but why, Dr. Ellis? Why can't you give it to me? And really, it's just that it is not well studied in pregnant women. And when a potential risk, so a risk to a little baby fetus, outweighs the benefit being not having wrinkles for a few months, then we generally like to err on the side of caution. That being said, there are some studies of women who have gotten Botox during pregnancy, either cosmetically by accident, they didn't know they were pregnant yet, or for the treatment of migraines where the risk did not outweigh the benefit. They needed to continue their Botox treatments for migraines during their pregnancy in order to keep their pain under control. And what it showed is that there's no adverse fetal outcomes or no increased risk to the fetus when mom gets Botox while she's pregnant. So it's not that Botox is explicitly unsafe for pregnant women or unsafe to an unborn fetus, but we just don't have enough data yet to say that it is explicitly safe for a pregnant woman and unborn fetus, which is why we don't inject it cosmetically during pregnancy. Now, there are other specialties in medicine, people who manage people with pain disorders and movement disorders who do inject Botox during pregnancy. And so we might be getting more data in the future that helps us guide our decisions. But from a cosmetic perspective, I'm not injecting any pregnant lady with Botox. No one asked this question, but I can feel it coming sort of in the association with Botox and pregnancy, which is Botox and breastfeeding. And I think different injectors have different views on this. I mean, when Botox is injected into the muscle, it doesn't get into systemic circulation. The protein is thought to be too big to enter breast milk. Do I know tons of dermatologists who personally have had their Botox done while they're breastfeeding? Yeah, absolutely. Would I feel comfortable getting Botox while I was breastfeeding? Definitely. But whether or not your injector has that same comfort level and whether you have that comfort level is always going to be a conversation. So I think it's something that I don't think is explicitly a no-go, but needs to be a conversation between you and the person doing your injections. I got Dysport almost a week ago and have felt headaches on and off since then. Normal? Super normal. So any side effect is actually not very common with neurotoxin injections, but if I had to pick the most common of the uncommon side effects, it's headache. These are generally mild headaches that respond pretty well to over-the-counter treatments like Tylenol or Advil. They can last for up to a couple weeks after treatment, so it's just something to be aware of, but yes, it's a normal side effect. How much does a standard session cost? Oh, this is gonna vary so much by who's doing your injection, what the clinic site is, what state you're in, what country you're in, what city you're in. All of that is going to change what the cost can be. Some clinics will charge for Botox by the unit, whereas some will charge by the area. So for example, if you are treating your glabella, which is sort of this central complex that addresses those 11 lines, a standard dose in that area is about 20 units of Botox. And some clinics will charge everyone the same amount for that area. That's charging by area. So however many units it takes, everyone's paying the same fee. Or people will charge by unit. So if you need 20 units, you'll pay a different amount than if you need 18 units versus if you need 22 units. And there are different philosophies in terms of if a clinic's gonna charge by unit or charge by area. I think people who charge by area generally have the mindset of the patient is coming in to pay for a result. They're not paying for the unit, because it's not about the unit, it's about the end result. It's sort of like when you go get your hair cut, you're not paying by the number of inches that are cut off or the amount of dye used, you're paying for the final kind of hair outcome. And then the unit cost can really vary. I think I've seen as low as like $10 all the way up to $30 a unit. And usually built into that unit cost is the thought of like who's doing the injections, what the clinic site is like, is it really high end, what the customer service is like there, etc. And how much it's gonna cost you per session is totally like, how much are you treating? Are you just getting this little area done? Are you getting full face and neck Botox? I think you can expect to spend somewhere between like $300 and $2,000 on your Botox, depending on how much you're having done and where you're getting it injected and who's doing your injections. But do not bargain hunt for your Botox injections. It is still a medical procedure. And if someone's all up on Groupon offering their Botox services, you kind of have to wonder, like, why do they have to do that? It's really not fair that Botox is a luxury to have and that it costs money and it can be quite expensive for people. But at the same time, it's really important to get injected by someone who's knowledgeable, who has expertise, that is always going to have your back and prioritize your safety as well as your aesthetic outcome. Can you build a resistance or tolerance to it? Yes, you can, but that is super rare. I can think of one patient I've ever met who has a true resistance to Botox, but then we injected Dysport for her and she totally responds to that, but it is really uncommon. Okay, round one done of Botox Q&A. I have a feeling this may generate even more questions, and if it has, definitely put them in the comments below. I'm also curious if you have ever gotten Botox. Don't forget to like this video and subscribe, and we'll hang out next time.